Somewhere in this country, right now, someone just set down the phone after a doctor's appointment and heard the word dementia. They'll spend tonight staring at the ceiling, replaying every forgotten name, every missed appointment, every time they walked into a room and couldn't remember why. And here's the part almost nobody tell. Ask them. For a meaningful number of these people, the real cause isn't sitting in their genes or their age. It's sitting in a little bottle on the bathroom shelf, a bottle they were told was perfectly safe. I've spent years looking closely at how medications interact with the aging brain, and I want to walk you through something that doesn't get nearly enough attention. There's a whole category of everyday, common, often over-the-counter medications that researchers have repeatedly linked to faster cognitive decline in older adults. Not exotic drugs, not rare prescriptions, the kind of pills sitting in nightstands and medicine cabinets in almost every home with someone over 60. By the end of this video, you're going to know exactly which categories of medication carry this risk, why they affect the brain the way they do, and this is the important part. What you can actually do about it, because unlike most causes of memory decline, this one is often reversible. That's not a promise. I make lightly. It's backed by real clinical research, and it's the reason this topic deserves your full attention today. Before we get into it, drop a comment letting me know if any of these medications sound familiar to you or someone you love. It helps me know what to cover in future videos, and I rate every single one. Let's start from the bottom of the list and work our way up to the one I think is the most important idea in this entire video. Not a single drug, but a pattern that almost nobody is watching for. I also want to say this clearly, right at the start. Nothing in this video is a reason to stop taking anything on your own. Some of these medications are genuinely dangerous to stop suddenly, and I'll flag those clearly as we go. This video exists to give you the right questions to bring to your doctor or pharmacist, not to replace them. With that said, let's get into it. Number 9. The little pink pill in almost every home. We're starting with something so common it barely registers as medication anymore. Diphenhydramine, the active ingredient in the classic allergy and sleep aid most people know by its drugstore name. It's the pill people reach for when they can't sleep, when allergies flare up, or when a cold hits and the Y just want to feel normal again. It's cheap, it's sold without a prescription, and that combination makes people assume it must but gentle. Nothing that easy to buy could possibly be risky, right? Here's the piece that gets left out. This drug belongs to a class called anticholinergics, medications that block a brain chemical called acetylcholine. Acetylcholine is essentially the messenger your brain relies on to encode new memories and stay mentally alert. As we get older, the brain naturally produces less of it and depends more heavily on what's left. So a drug that blocks that same chemical lands with far more force on an older brain than on a younger one. The structure that absorbs most of that impact is the hippocampus, the part of the brain responsible for turning short-term experiences into lasting memories. In clinical practice, this shows up quietly. Someone starts taking a nightly antihistamine for sleep, and over months or years, their thinking gets foggier, their recall gets slower, and they never once connect it to the pill by the bed. Multiple studies looking at long-term anticholinergic use in older adults have found a meaningfully elevated risk of cognitive decline and dementia diagnosis compared to people who avoid these medications regularly. Here's what to actually do with this. Check the label on anything you take for sleep. Anything marketed as PM, nighttime, OR, allergy relief. A huge number of these products are just the same anticholinergic ingredient rebranded. If allergies are the real issue, newer generation antihistamines exist that don't cross into the brain nearly as easily and carry a much lower cognitive risk. And to be absolutely clear, never stop any medication on your own. Bring this to your doctor or pharmacist and ask directly, is there a safer alternative for what I'm treating? Number 8, the heartburn pill. Nobody questions. Next up is a class of medication your stomach loves and your brain may quietly be paying for. Proton pump inhibitors, sold under familiar brand names for acid reflux and chronic heartburn. These drugs shut down acid production in the stomach, and for people dealing with reflux, the relief can feel life-changing. The problem is that many people end up staying on them for years, sometimes decades, because the moment they try to stop, the burning comes roaring back, which makes it feel like the medication is the only thing holding things together. What almost nobody explains at the pharmacy counter is this. Stomach acid isn't just there to cause discomfort. Your body needs it to properly absorb certain nutrients from food. And one of the most important is vitamin B12, which plays a direct role in protecting nerve and brain function. Suppress acid production for long enough, and B12 levels can quietly decline. Magnesium and calcium absorption can be affected too, both minerals your neurons depend on to fire and communicate properly. starve brain cells of these nutrients over time, and you can end up with confusion and memory lapses that look remarkably like early cognitive decline, when the actual root cause is a nutrient deficiency driven by the medication itself. Large observational studies following older adults on long-term acid suppression have found significantly elevated dementia risk compared to non-users, and some research. H has also pointed to changes in amyloid-related brain proteins associated with prolonged use. The same proteins implicated in Alzheimer's pathology. If you're taking one of these medications every single day, that's worth a real conversation with your doctor. Many people can safely step down to a gentler class of medication or manage symptoms with dietary changes in short term rather than continuous use. The goal with any acid-suppressing medication should be the lowest and effective dose for the shortest necessary time, not an indefinite habit. Number 7, the bladder medication with a hidden trade-off. Number 7 covers a category prescribed for something most people would rather not discuss openly: overactive bladder medications, with oxybutynin being one of the most commonly used names in this class. It's prescribed to people dealing with sudden, urgent bathroom needs that can genuinely reshape someone's entire day. And the relief it offers, along with the embarrassment it prevents, is real. But oxybutynin works through the exact same mechanism as that nighttime allergy pill we talked about earlier. It blocks acetylcholine, and it crosses into the brain quite easily, settling right into the regions responsible F, or memory formation. That combination makes it one of the more concerning medications on this list for long-term use in older adults, especially when it's taken month after month, year after year. Research following older adults on strong anticholinergic bladder medications for extended periods has found substantially elevated dementia risk. And troublingly, most people taking these drugs were never warned about this connection at all. They were told the medication would calm their bladder. Nobody mentioned it might also be dimming their memory in the process. And because the symptoms, forgetting appointments, losing track of conversations, misplacing things repeatedly, look exactly like ordinary aging, they usually get written off as just getting older rather than traced back to the prescription. If you're on this type of medication and you've noticed memory changes, take it seriously. You shouldn't have to choose between bladder control and cognitive health. Newer medications in a completely different drug class treat overactive bladder without touching the acetylcholine system at all, and for many older adults, they offer similar symptom control with far less cognitive risk. It's absolutely worth raising at your next appointment. Number 6, the cholesterol drug. Everyone assumes is simply good for you. This next one tends to surprise people because it's one of the most widely prescribed medications on the planet. Statins. Drugs like simvastatin and atorvastatin are staples of cardiovascular care, especially after age 60, and they do genuinely important work lowering cholesterol and reducing heart attack and stroke risk. I want to be clear up front, this is not an argument against statins. For a lot of people, they're protecting against a very real and immediate threat. But there's a piece of the story that rarely gets discussed. Cholesterol isn't just a heart health number. Your brain is nearly 60% fat by composition. And it relies on cholesterol to build myelin, the insulating layer wrapped around nerve fibers that allows electrical signals to travel quickly and cleanly. Push cholesterol down aggressively enough with a strong enough statin, and it's possible to leave the brain short of a raw material it genuinely needs to function well. Not all statins behave the same way here. The ones that cross more easily into brain tissue appear to carry more of this risk, and some research following older adults on these particular statins for several years has found higher rates of measurable cognitive impairment, with the effect appearing to scale with dose. Patients describe things like a familiar name suddenly slipping away, a conversation from minutes ago going blank, or a route they've driven for 20 years feeling unfamiliar. The important nuance is that not every statin carries the same risk profile. Some formulations don't cross into brain tissue as readily and are generally considered gentler on cognition. If you've been on a statin for years and you're noticing new fog or forgetfulness, that's absolutely worth discussing with your doctor. A dose. Adjustment or a switch to a different statin might solve it. But this is not a reason to stop a medication that may be actively protecting your heart. Get any change reviewed and guided by a professional. Never done alone. If this is connecting some dots for you, a quick like helps this reach more people who need to hear it. And I'd love to know in the comments how many prescriptions you're currently managing. Number 5, the anxiety and sleep medications. With a difficult exit. By boosting GABA, the brain's natural calming signal that helps quiet an overactive nervous system. At first, they can feel like an absolute rescue. The panic eases, racing thoughts slow, and sleep finally arrives after nights of struggling. But over extended use, the picture tends to shift. Research following older adults over multiple years has linked longer-term benzodiazepine use to a meaningfully elevated risk of developing Alzheimer's disease, with longer-acting versions of these drugs appearing especially problematic, since they linger in the body and accumulate in fatty tissue, including the brain itself. What these medications essentially do, over time, is create a slow chemical sedation across the entire brain. Learning slows down, mental flexibility decreases. Many long-term users describe a kind of emotional flatness, moving through life in a fog, no longer feeling entirely like themselves. And here's the genuinely difficult part. If a benzodiazepine is stopped abruptly, anxiety and insomnia can come back even more intensely than before, sometimes accompanied by dangerous agitation. That's what makes these medications feel indispensable at precisely the moment they may be causing the most harm. So here's the rule, and it matters enormously. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly under any circumstances. Doing so can be genuinely dangerous. Any change needs to happen gradually, under close medical supervision, tapered over weeks or months. There are gentler alternatives for anxiety that don't carry the same sedating, clouding effects, and there are structured non-medication approaches to chronic insomnia that can restore healthy sleep without the cognitive cost. Number 4, 1 medication, 3 uses, 1 heavy hidden cost. Number 4 is amitriptylines, an older generation antidepressant still widely prescribed today, not just for depression, but for nerve pain, sleep difficulties, and migraine prevention. That versatility is exactly why it's stayed so common. On paper, it looks like a medication that can quietly solve several problems at once. Underneath that convenience, though, it's actually one of the most potent anticholinergic drugs still in regular use, meaning it blocks acetylcholine aggressively, the same memory-critical chemical we've already discussed twice in this video. With long-term use, memory problems associated with this drug stop being a rare side effect and start looking more like an expected outcome. Studies tracking cumulative anticholinergic exposure in older adults over a decade have found substantially higher dementia risk among those with the heaviest long-term exposure to drugs like this one, and most of them were never told the medication carried that risk. They were prescribed it for pain or for sleep, and gradually noticed words becoming harder to find, memory thinning out, concentration weakening, and assumed, understandably, that it was simply age catching up with them. It doesn't take a high dose for this effect to accumulate. A small nightly dose, taken consistently for years, can quietly erode cognitive function with no obvious warning sign until real, measurable loss has already occurred. If you or someone you love has been on this medication long term, it's worth a conversation soon. For nerve pain, there are alternative medications that don't carry the same anticholinergic burden. For sleep, there are gentler options with a much lower cognitive footprint. And for mood, several newer generation antidepressants are generally considered far safer choices for long-term brain health in older adults. Number 3, the one prescribed for something that sounds completely harmless. This is the one I told you to watch for: paroxetine, a widely prescribed SSRI. Antidepressant used for both depression and anxiety. On the surface, it looks like a modern, gentle option, far kinder than older generation psychiatric medications. But there's a detail that rarely gets discussed openly. Of all the commonly used SSRIs, this one stands out for having notably strong anticholinergic activity. The same brain chemical blocking mechanism running through nearly every medication we've covered so far. Research comparing cognitive outcomes across different SSRIs in older adults has found measurable declines in short-term memory, word recall, and attention within roughly the first year of use in people taking this particular medication at rates higher than those seen with other antidepressants in the same class. There's a real irony in that finding. A medication prescribed specifically to stabilize someone's mental state may, over time, be eroding the very clarity it was meant to protect. Because of this pattern, it's generally considered a medication worth avoiding in older adults when alternatives are available, and it appears on formal clinical guidelines listing medications considered potentially inappropriate for seniors specifically because of this risk. If you're taking it, it's worth asking your doctor about switching to a different SSRI that doesn't carry the same anticholinergic profile. And alongside any medication change, supporting healthy B vitamin levels, particularly B12 and B6, can play a supportive role in overall mood and cognitive health. Number 2, the medication. Many people don't realize they're even taking. Number 2 covers something that concerns me more than almost anything else on this list: antipsychotic medications, prescribed so quietly that many people taking them don't fully understand what class of drug they're on. These medications, including quetiapine, risperidone, and olanzapine, were originally developed for serious psychiatric conditions like schizophrenia and bipolar disorder. Today, though, they're frequently prescribed off-label to older adults for far more ordinary problems: sleep trouble, restlessness, or agitation. associated with dementia itself. Powerful medications designed for severe psychiatric illness are, in practice, being used in homes and care facilities for older adults who are simply confused, restless, or difficult for overstretched caregivers to manage in the moment. The cost of that can be significant. Large studies following older adults prescribed antipsychotics for behavioral symptoms have found substantially worsened cognitive decline within a year, even in people with no prior history of dementia, along with increased risk of stroke, sudden cardiac events, and sedation-related falls. These drugs work by suppressing dopamine, a chemical involved not just in mood, but in focus, planning, and memory formation. Suppress it enough, and the brain becomes measurably slower and less responsive, which is why people on these medications can sometimes appear emotionally flat or strangely distant, while their families quietly grieve someone who's still physically present but seems to be fading. If you or someone you love is on one of these medications, the first step is a direct question to the prescribing physician. Why was this started, and is it truly necessary, or is it primarily being used for convenience? A lot of behavioral symptoms in older adults can be improved without medication at all through consistent routines, reduced overstimulation, better pain management, and improved sleep and lighting. When medication genuinely is necessary, the lowest effective dose for the shortest duration matters enormously. Too many families are never told what these drugs can do to cognition. They watch a decline they assume is simply aging, when the real driver may be chemical. Number 1. The pattern. Almost nobody is watching for. Now, we arrive at number 1, and it isn't a single medication at all. It might be the biggest hidden driver behind everything we've just discussed. Anticholinergic BeiDou from taking multiple medications at once, otherwise known as polypharmacy. You were probably expecting one final villain, one single worst pill. The truth is more subtle than that, and honestly more important. The greatest danger often doesn't come from any one medication. It comes from the slow accumulation of several anticholinergic drugs taken together, while nobody ever adds up the total effect. Picture a very ordinary, very common scenario. Someone takes an antihistamine every night for sleep, a bladder medication every day, and an old antidepressant for nerve pain. Individually, each one might produce a small, barely noticeable effect on its own. Together, those effects compound, and the cumulative load on the brain rises far faster than any single prescription would suggest. Large-scale studies tracking overall anticholinergic burden in older adults have found dramatically elevated dementia risk in those carrying the heaviest combined load. And the overwhelming majority of them had no idea they were even taking anticholinergic medications because no one had ever explained the concept to them or added up the total across their prescriptions. When acetylcholine gets blocked from several directions simultaneously, the brain doesn't just slow down a little. Neurons can begin to weaken from chronic underuse. Connections can shrink, and the brain can settle into a quiet, underpowered state that looks remarkably similar to Alzheimer's disease on cognitive testing, even when the actual cause is entirely medication-driven. And here's the part that matters most. The reason I wanted to make this video in the first place. Medication-related cognitive decline is often reversible when it's caught early. Reduce the burden, and many people genuinely regain clarity, energy, and memory within weeks to months. The brain is far more resilient than most people assume, but only once the source of the harm is actually removed. The solution here doesn't require anything dramatic. It requires a careful, honest medication review. Sit down with your doctor or pharmacist and go through everything. Every prescription, every over-the-counter product, every supplement. There are simple scoring tools clinicians use to calculate total anticholinergic burden, and the asking to have yours calculated is a completely reasonable request. Once the problematic medications are identified, unnecessary ones can be reduced or discontinued under proper medical supervision, safer alternatives can be introduced where needed, and the brain can finally get the chance to recover. Of everything on this list, this may be the single most preventable threat to cognitive health in older adults, and that's exactly why it earns the top spot. So here's what I want from you. I'm curious of the categories we just went through, which ones are sitting in your medicine cabinet right now? Have you noticed brain fog or new forgetfulness after starting a medication? Tell me in the comments. And if this changed how you're thinking about a prescription you or someone you love is taking, commit right now to asking for a full medication review this week. Your comment might be exactly what helps the next person reading it. Make that same call. One last thing before you go. Your medicine cabinet isn't the only place your body quietly leaves warning signs. Your hands can too. Your fingernails, specifically, can reveal early clues about kidney function, blood health, and even nervous system problems, often years before other symptoms show up. Most people never learn what to actually look for. That's exactly what we're covering next. So